welcome back to my channel. I am so excited to film this video for you guys today because the subject matter is something that is so very important and so very personal to me. So some of you may know, but most people do not know that November is actually Epilepsy Awareness Month. If you're not really, most people know what epilepsy is, but in case you do not know, epilepsy is an illness that causes people to have seizures. It's a little bit more than that. I'm actually, during this makeup tutorial, I'm actually going to be giving facts about epilepsy so that we can all get a better understanding of it. But epilepsy awareness is very important to me. My mother was actually diagnosed with epilepsy when she was 26 years old. So she's had epilepsy my entire life. I've also got a very, very dear friend who was diagnosed with epilepsy a few years ago. I had a coworker, also a dear friend, whose daughter had epilepsy, and she very sadly passed away from it. That was the first death that I've ever experienced from epilepsy. People do die from it. I've also got an old boss of mine whose son has epilepsy. So there have just been countless people come into my lives with this illness, and it's something that I am so passionate about bringing awareness to. I am definitely an advocate for epilepsy awareness. So what we're going to do today, the color for epilepsy is purple. I actually have, I posted a picture of it on my Instagram, but I have a purple awareness ribbon on my ankle. That ribbon is for my mom, but I posted a picture of it. So the awareness color for epilepsy is purple. So today we are going purple for epilepsy. We are going to do a purple epilepsy awareness eye look today. Like I said, I'm going to be giving you guys some facts about epilepsy while I am doing this makeup tutorial for you. Let me go ahead and grab me a sip. And let's jump into this tutorial. So you may notice I do not have the rest of my makeup on. Usually I do. Lately I have really been liking doing my eye makeup before I do anything else. It's not something I was ever into before, but lately I feel like it's a good thing, and today I just feel like doing it that way. So I should have done my brows first, but let me go ahead and do my brows really quickly. And I'm going to try to do this kind of chit-chat, get ready with me style, because I want to give you guys these facts as well. So let me pop some brows on really quickly. I didn't comb these through yet. So I'm going to comb these through. I am trying to get some stuff together to do an eyebrow video for you guys. It had been requested by one of my subscribers who actually happens to be a friend of mine. Like, physically, I know her. Like, I was just at her son's birthday party. But she had requested an eyebrow video. So I'm trying to get some stuff together to do an eyebrow video for you guys. Just know what kind of products I like to use and that sort of thing. I'm not going to go really crazy with these brows today. But I've had people before ask me how I do my eyebrows, and this is how I do it. I just have a little angled brush. I've had this brush forever. It came in a set that I got from Claire's, like, I swear, 10 years ago. But I just pack my brow powder onto this, and with it going up and down, I'll just place it right at the edge there. And I'll just bring it a little bit, just to where the brows are thick. I'll just bring it through a little bit, and then I'll go over the top to create the top of that arc that I want. And then where all of the majority of that brow powder is, I'll just pull that through the rest of it. And kind of try to meet that tail. But I don't fuss with it a whole lot. I'm going to bring this mirror a little bit closer. Usually my mirror is higher, and since I'm filming today, I don't have the risers underneath it. I have these little acrylic boxes that I got from Dollar Tree. I have two of them. They sit on top of each other, and then my mirror sits on top of that. So that's, sorry, that was loud. So that's how I bring my mirror up. But, like, you care. I don't know. Okay, so there's that one. I have in the past used brow wax on top of the brow powder. Um, I don't know. I mean, I liked it when I was doing it, but sometimes I don't. I am one of those people that does not like to fuss with my brows. If I didn't have to fill my brows in, I wouldn't do it. But after I get all my makeup on, my brows do kind of disappear a little bit, so I do have to fill them in. But I'm just one of those people that doesn't like to fuss with my brows. But people ask me quite often how I do them because I've gotten compliments on them and people ask me, how do you do your brows? And this is how I do it. I just don't fuss with them that much. Like, I've watched the, some of the tutorials that, like, Anastasia Beverly Hills will post on their Instagram. And I'll watch, you know, other YouTubers, other beauty YouTubers do their brows, and they just fuss so much with them, and I don't know. I just don't have the time or the patience to do that. So I just work with what God gave me, and I just kind of fill them in. I don't really, like I said, I don't fuss with them. Okay, so that's good for me there. Okay, so let's do our first epilepsy fact. Um, I've got it pulled up here on Google. So, first epilepsy fact. What is epilepsy? Epilepsy is a neurological disorder caused by malfunctioning nerve cell activity in the brain. These malfunctions call episodes, which are called seizures. So that in a nutshell is what epilepsy is. You could go so much more in depth with it, but that in a nutshell is what it is. Like I said, my mother was diagnosed with epilepsy when she was 26 years old, so I was 6. Um, I don't want to give you guys too much detail about her story because she doesn't even know that I'm filming this video. So I haven't gotten permission from her to tell all that stuff. But I can tell you a little bit from my perspective from it. So, like I said, she was diagnosed when she was 26. I was 6 years old. I have seen her have countless seizures. And I can tell you from the standpoint of a loved one, someone on the outside looking into it, it is scary as hell, you guys. My mom has said before that she would not wish epilepsy on her worst enemy. That is how bad it is. It's really bad. But really quick, I'm just taking just a very light shade right here and just putting that all over my lid. But yeah, I've seen her have countless seizures. She actually, I lost my train of thought. She has, and usually she does, if I'm around when she has a seizure, she usually asks for me or calls for me. The first time I ever saw her have a seizure, I was probably about 7 or 8. And she had a full-on grand mal convulsion type seizure, and for a 7-year-old to witness that, especially for a 7-year-old to witness their mother going through that, that was really scary. And there's really nothing you can do for it. I mean, you just kind of have to let it take its course, and all you can really do is just be there. Um, I have never felt more helpless in my life than when I have witnessed my mother have a seizure. It, I cry every time. I cry the entire time because there's absolutely nothing you can do. You are so helpless in that situation. And I know if I feel helpless watching it happen, how much worse can that be for her actually going through it? It's not something I like thinking about, but yeah, yeah, but like I said, I saw her have the first time I saw her, I was 8 years old. Um, she had asked for me, and like I said, all you can do is just sit there and let it happen. Let's see. Next, I'm gonna go in with this kind of light shimmery purple here, and that I'm gonna take this fluffy brush, and I'm gonna put that kind of all over my lid. I might have to go in and pack this color in a little bit, but for right now, I'm just gonna kind of give it a little. Oop, and my tablet's dying, so I need to give you some facts pretty quickly. I'm just gonna go in and just kind of fluff that on really quickly. Okay, so let me give you another fact about epilepsy. So I've told you what epilepsy is. Now, seizures can be divided into two main types. The first one being focal seizures. There are also two subtypes of focal seizures. The first one being simple, which less than 15% of people with epilepsy have simple focal seizures. Subtype number 2 is dyscognitive. More than 33% of patients with epilepsy have dyscognitive partial seizures. Hold on one second. Let me fill this in. I'm trying to do too many things at once, and multitasking is not. Usually multitasking is a strong suit for me, but right now it's just not working. Let me get this purple, this shimmer purple all over this lid, and then let me give you another epilepsy fact. So we talked about focal seizures. The second main type of seizures is generalized seizures, and more than 30% of people with epilepsy experienced generalized seizures. The subtypes include tonic, clonic, myoclonic, absence, atonic, and tonic-clonic. My mother has gone through a range of seizures when she was first diagnosed with epilepsy, and she started having seizures. She would have petit mal's, but she would also have grand mal's. Grand mal's are the bad ones. Those are the ones that wipe you out for days. But yeah, she would have like full-on convulsion type seizures. And convulsions, when you talk about seizures, most people think convulsions, but seizures are not always convulsions. So there's convulsions. She has also had these episodes that they, for the longest time, said that they were just panic attacks. But it turned out that they were seizures. So she went through that. Then she started having paralysis, which I don't know the exact name for that type of seizure. I think it is paralysis. But what that is that when she would go into a seizure, I witnessed her having one of these. And the time that I saw her have one, what happened was she was sitting in a living room, and she went into one of these paralysis seizures, and I thought I heard one of the dogs whining, but it was actually my mom. And I went out into the living room, and she was lying on the couch, stuck in the fetal position. She could not move. she could not say anything. She was just stuck in that fetal position, and she was shaking just a little bit. And she was trying to scream, but she couldn't. That one was tough to see too, because that was just kind of eerie. They have those, and then she's had the absences, and those she has told me we're supposed to wake her up. I don't wake her up because I'm afraid to. But what happens with an absent seizure is that the person will just be sitting there, and you can be having a conversation with them, and they'll just go silent, and they'll be sitting there, and it's almost like they're completely comatose. They can't speak. They're just sitting there, like they're not there. They're absent. That's exactly what it is. She has told me that she can still hear what is going on, but she can't respond. So like she can't move her head. She can blink. That's pretty much all she can do. So she's had those. So she's kind of run the gamut of seizures. She actually went for, was it 5 or 10 years without any seizures. She finally had decided, I'm not doing this medicine anymore. The medicines that they put you on for epilepsy and for seizures basically turns you into a functioning zombie. Really, they just dope you up. That's all they can do. And those medicines suck. They make you gain weight. And she didn't like the way she felt. So she said, I'm not doing this anymore. She quit. And lo and behold, magically, for like 5 or 10 years, she didn't have any seizures. And when they came back, that's when she went through the gamut of all of the different types. At the end of it, right before she had her surgery, she had gone back into having convulsions. But yeah, so those are the different types of seizures that you can have. Let's go in and put some darker purple in here. I thought, another fluffy brush. I have done so much makeup over the past couple of days. Halloween was Tuesday, so I still don't have all of my brushes where they need to be. So I'm just going to go in with this kind of denser brush. This is my Luxie Small Tapered Blending Brush. I like to use this for my crease and sometimes for my outer corner. But I'm going to go in with this Milani Bella Eyes Gel Powder Eyeshadow in the color Bella Purple. This is one of my favorite purple shadows that I have. Tap off some of that excess. I'm just going to kind of tap this in right in here and then work it into my crease. Get a little bit more of that in here. I'm going to need a denser, like not a denser, fluffier brush. And I don't know where it is. Let me pause you for a minute. I'll be right back. I found it. It was right in front of my face. So I have this brush now. I'm going to go in with this one. This is a Wet n Wild eyeshadow brush. I'm going to go back in with that Bella Purple. Get a little bit more of that on there. This one seems to pack the color in a little bit better. It's not really showing up as dark as I want it to, though. Okay. And then I'll go back in with this blending brush. Kind of work that in there. So I've kind of overworked that darker purple a little bit too much. So I am going to have to go back in here a little bit and pack some more of that lighter purple in. So we'll do that here in just a minute. Let me pack some more of this color on this eye. And we'll do some more epilepsy facts. So as far as treatments for epilepsy, the ones that I know of, we've already talked about the medication, which basically just turns you into a functioning zombie. There are some other treatments that they can give you for it. I'll tell you about the ones that I know. There's a VNS, which, you know what, let me see. Let me open another browser here, another browser window, and I can tell you exactly what a VNS is. I know what it does, but I want to give you a really good VNS implant. I want to give you a really good description of what that is. So, okay. A VNS is a device used to treat seizures when seizure drugs are not effective and surgery is not possible. VNS consists of a pacemaker-like generator that is implanted in the chest wall and is programmed by the physician to stimulate the vagus nerve in the neck. So what they do is they, it's kind of like a magnet. They put that implant in your chest, like it said, and there's a wire that they connect to the vagus nerve on the back of your neck. The vagus nerve connects to your brain. And what you do is there is another magnet that you're supposed to keep on you all the time. You can slide it right onto your hand. There's a little strap. You can slide that onto your hand. You can clip it onto your pants or whatever so you can keep it with you all the time. And what you do is when you feel a seizure coming on, you take that magnet and you pass it over the area where that implant is, and that wire sends a signal up to your vagus nerve, and it kind of sends a pulse through your brain to kind of stop the seizure. Now, as far as being able to know that you're having a seizure, not everybody that has epilepsy knows that they're having a seizure. There is a thing called auras, which I will tell you about right here. But auras are kind of, they're a feeling that you get right before you have a seizure that tells you, hey, I'm about to have a seizure. Like I said, not everybody has them. I truly feel that auras are a blessing because my mom has auras. So she has always known if she was going to have a seizure, she could tell, her body was telling her this is about to happen. So she could always get to someplace safe. And it is truly a blessing. And like I said, not everybody has those. I saw that here just a minute ago. Let me see. Okay. That is not the one that I wanted. It may not be on here. I may have just told you everything that I can tell you about auras. Yeah. So with that, since we talked about auras, an aura is one symptom of a seizure. Here are some other common symptoms before a seizure. Déjà vu. Jamais vu. My mom has said that déjà vu, that really does happen. Smells, sounds, tastes, visual loss or blurring, racing thoughts, a strange feeling of fear or panic. Remember I talked about my mom having those panic attacks? And they said it was a seizure. Dizziness, lightheadedness, headache, nausea, and a numbness or tingling. My mom has talked about that before too, having the numbness in her fingers. She's told me that it kind of felt like, I mean, it feels like a tingling, but if you ever felt a mink blanket, like if you rubbed your fingers together, it felt like you were rubbing a mink blanket. Is what she said it felt like. She told me that when I was really, really little, though. And then it says acting quickly is important. Seeking medical attention and or performing seizure first aid is crucial. So there are some symptoms of epilepsy. So let's go back in and pop some more. You know what? Let's get this brow bone done real quick. And then we'll go in and pop some more of that shimmery purple right in here. So what do I want to use for? I usually use, you know what? I have this brand new thing here and I don't like any of those colors. Okay. Wasn't prepared for this part. I should have been. I don't know why I'm not. Let's see. I'm going to go in with some highlight. What I'm going to do, I'm just going to do some highlight. Oh, you know what? Since I'm going to do highlight. So I have this rainbow highlighter here. I actually use this for Halloween too. I'm going to put that up top. So I'm just going to go in with this brush here. I like a shimmer on my brow bone. I don't know why, I just think it looks good. I think it pops that eye out and it pops that brow bone so good. So here is another interesting epilepsy fact. Did you know that Saint Valentine is the patron saint of epilepsy? It's true. Okay. Let's go back in and pop some more of that purple shimmer in. I might even want to do this wet. So I've packed some of that color onto a flat eyeshadow brush, and I'm going to take my primer spray here and wet that a little bit, and I'm going to pack that back into this inner corner area. Okay. Use some more of this primer spray and pop it back into my inner corner area. Okay, now that I've done that, I wonder if I can go back in with, you know what? I'm going to take one of these eyeshadow brushes and go in with this purple, this darker purple. Yeah, pop that a little bit more. Yeah, there we go. That's what I was looking for. There we go. That's exactly what I wanted. Okay, so let me go back in with this blender brush and, not the blending brush, but eyeshadow brush just to blend that together a little bit better. So there is that. Let me go pop on some liner and I will be right back. Okay, so obviously I did a little bit more than just pop some eyeliner on. I went ahead and finished out the look. For the lips, because let's just talk about those for a minute, I used my NYX Liquid Suede in the shade Amethyst for my lips. For the rest of the eyes, I took that shimmery, that light purple shimmer shade and put that all under my, kind of smudged that under my lower lash line. And then this darker shade is my Urban Decay 24/7 Glide On Eye Pencil in the shade Delirious. Just kind of went halfway with that. And then for mascara, I used this LA Colors Big Lash Mascara in the shade Purple. I picked this up at Dollar Tree. You cannot always find it, but sometimes you can. My personal opinion, I like the blue better than the purple. The purple just doesn't seem to show up very much for me. It's very dark. So that is the finished look. We have definitely gone all out and gone purple for epilepsy awareness with this look. Before we go, I do want to share some more epilepsy awareness facts with you. So the first set of facts that I want to share with you is facts about epilepsy, ending the myths. Fact number 1, you cannot catch epilepsy. Epilepsy is not contagious. Now, I don't know anybody who thinks that epilepsy is contagious, but just in case you were wondering, it is not contagious. It is impossible to catch epilepsy from someone who is having a seizure. Epilepsy may be caused by head injuries, stroke, brain tumors, genetic conditions, lead poisoning, problems in brain development before birth, or illness that affects the brain like meningitis or encephalitis. I know in my mother's case, when she was diagnosed with epilepsy, they said that it was more than likely caused, it was more than likely the result of a head injury. Now, my friend who was diagnosed recently within the past couple of years, they told him that there was just a spot in his brain. The environment was just right in his brain, and it just had to be the right time for it to pop up. So it was just something that was kind of inevitable. He was born with it, but it didn't show up until he was in his late 20s. So fact number 2, many seizures do not involve convulsions. We kind of talked about that a little bit already. So signs of a seizure can include a blank stare, rapid blinking, or some chewing movements. If these signs are noticed, no immediate first aid is required other than reassurance and emotional support. First aid is necessary only if the seizure becomes convulsive. Fact number 3, a person who has a seizure cannot swallow his or her tongue. That is a myth. That is an old wives' tale. That does not happen. Someone having a seizure is not at risk of swallowing his or her tongue. Never place an object such as a spoon in the person's mouth, as it could break a tooth or injure the gums and may block the airway. So I know a lot of people have heard that if someone is having a seizure, you put a spoon in their mouth so that they don't swallow their tongue. Don't do that. That is a bigger risk. They can't swallow their tongue anyway. Fact number 4, people with epilepsy can drive. Individual states have different laws that specify the length of time a person must be seizure-free before allowed to drive. My mom hasn't always driven. She did. I don't think she ever got her license suspended, but there was a area of time where she did not feel comfortable driving. But for the most part, my mother has always driven. Now, my friend who I just talked about a little bit ago, who was diagnosed recently, he doesn't drive anymore. But like I said, my mom, remember I was talking about how my mom has auras and I feel like it is a gift from God. I feel like it's a blessing. That is why. My mother has always been able to drive. And that was one of the things. If she had an aura, she always knew, okay, I need to pull over. And what she would do is she would have that aura. She would pull over to the side of the road, turn her car off, take the keys out of the ignition, and throw them in the back seat. Because you can sometimes, in a seizure, you're not in control of your body. And if her keys were sitting right next to her, there was a risk of her being able to pick those keys up and put them back into the ignition while she was having a seizure. So she would always throw them in the back so that she knew they're nowhere near her. She doesn't even know where they landed, so she can't go find them and drive. But people can still drive with epilepsy. It just kind of like it says, it just depends on the state that you live in, and you know exactly what your epilepsy is like. Because it's different for everybody. Fact number 5, a seizure cannot be stopped by restraining the person. I don't know why you'd want to do that anyway. Never restrain anyone during a seizure. You could injure him or her. Move the person away from any sharp objects or hard surfaces. That's a really good one. Like it says, you don't ever restrain somebody with a seizure. Like I said, I don't know why you would want to. But yes, you always, especially if they're having convulsions, you want to try to put something soft underneath them so that they don't bump their head and get any injuries. Fact number 6, epilepsy is not a mental illness. Epilepsy is a physical disorder. The average seizure does not have any lasting effects on the brain. Many people with epilepsy have dozens and even hundreds of seizures in their lives without noticeable changes in intelligence or alertness. Fact number 7, People with epilepsy are not dangerous or possessed by the devil. Epilepsy is a neurologic disorder, and it is rare that someone having a seizure will harm another person. Fact number 8. You do not have to call an ambulance every time a person has a seizure. Unless the seizure lasts more than 5 minutes or is followed by a series of seizures, it is seldom necessary to call an ambulance. There are medications that can be used to stop prolonged seizures, but overall, let the seizure run its course. So like I said before, there's really nothing that you can do besides just let it happen. Fact number 9, epilepsy is largely an unsolved problem. Epilepsy is a chronic medical problem that, for many people, can be successfully treated as long as medications are taken regularly. Different treatments, such as surgery, drugs, vagus nerve stimulation, or VNS, or a special diet, are used to control different types of seizures. So there's many different kinds of treatment. Epilepsy is a common disorder. Very common. People don't realize that. Epilepsy is so common. I guarantee you that you know at least one person with epilepsy. I guarantee it. May not be like a friend, but I guarantee you maybe have a coworker or somebody in your church. There is somebody that you know that has epilepsy. I guarantee it. Epilepsy is the third most common neurological disorder in the United States, affecting nearly 3 million people. 1 in 26 people will develop epilepsy in their lifetime. The sad thing about this is that even though it is a very common disorder, and so many people have it, it is so taboo. People don't talk about it, and people don't understand it. Even though it's so common and people don't understand it, it makes people that have epilepsy feel like they are alone. It makes them feel like they are the only one. So depression is a big, what do you call it? Not a repercussion, but you know what I'm saying. It's a side effect. Depression is a big side effect of epilepsy because, like I said, people don't talk about it. It's taboo. So people that have epilepsy feel like they are alone. So a lot of them have depression too. And that is really, really sad. I think the conversation should really be getting started so that we really understand this disease and that we can make people feel like they're not alone, so that people absolutely know that they are not alone with this illness. Fact number 11, another very sad one. Epilepsy can be fatal. Epilepsy is a serious condition, and individuals do die from seizures. Experts estimate that prolonged seizures in the United States each year. Wait, what? Experts estimate that prolonged seizures are the cause of 22,000 to 42,000 deaths in the United States each year. In a major study of status epilepticus, 42% of deaths occurred in individuals with a history of epilepsy. This is sad because I actually do know somebody who died from epilepsy. I can't remember if I've talked about it or not, but I had a coworker who is still a very dear friend of mine, whose daughter had epilepsy. And, she had it bad. What's really sad is that she died so young. In her senior year of high school, halfway through, right? Not even halfway through, like right around prom, like the year was almost over. She had to be hospitalized because she would have seizures back to back to back to back to the point that she would have to be hospitalized. And she actually ended up being hospitalized after this series of seizures, and she didn't make it through. She actually did pass away in the hospital. And she is the first and so far only person that I know who has died from epilepsy. But it is just so sad because she was so young. She was in her senior year of high school. And she was such a precious girl. She was so full of life, and she was just happy all the time. But yeah, it can be fatal. Okay, fact number 12. People with epilepsy are not disabled. They can work and lead productive lives. Like I said, my mom always drove. She always had a job. My friend, he still works. He's fully functioning. People with epilepsy are not, they're not, I don't know what I'm trying to say. Like I said, they can lead normal lives. It's not something where they have to be bedridden. Um, they can be very productive and have epilepsy. People with epilepsy whose seizures are completely controlled have the ability and intelligence to work most jobs. Some have severe seizures and cannot work, but each person's ability and limitations should be considered individually. So, like I said, there are people that have them, that have seizures so frequently and so intense that they can't work. For a while, my mom did go through a little bout where she wasn't working because she was having seizures so frequently that she was having to take off work a lot, because this is another thing that people don't understand about seizures. They wipe you out completely. You are completely exhausted after a seizure, and you can be wiped out for for weeks at a time sometimes. But I mean, it completely wipes you out. You were completely exhausted. So there was a small span of time where my mom was not working, but she'd always worked up to that point, and she's working now. So that's all of those. Now the last few facts that I want to share with you, and then I will wrap this up. So over a lifetime, 1 in 26 people will be diagnosed with epilepsy. We've already kind of talked about that. Epilepsy is very, very common. I need to get a sip. I'm getting hoarse. And I know you guys can hear that. I can still hear it, actually. So yeah, it's very common. And like I said before, I really think that we need to have the conversation going so that people know that they're not alone in this. 150,000 Americans are diagnosed with epilepsy each year. Americans spend more than $15.5 billion caring for and treating epilepsy every year. So that is all of my epilepsy facts for you. I hope you enjoyed the makeup look. I hope that this video was informative for you guys. I encourage you to go out and inform yourselves a little bit more. Find out, most places have epilepsy walks and epilepsy runs in November. Find your local epilepsy program. See if you can get involved. More than anything, just educate yourself about it so that you know what this illness really is, and so that you can spread the word as well. I just went completely blank. I hope you guys enjoyed the video. I hope it was informative again. If you have not already, if you are new here, hi, thank you. Thank you so much for joining me for this being your first video. I really appreciate that. But go ahead and hit that subscribe button down below. While you're at it, hit the bell next to it. That's going to give you notifications on when I post new videos. Also, if you're not following me on Instagram, follow me there as well. And on Facebook, both Epilepsy Beauty 82, the same way that it is spelled here. I will be sharing epilepsy facts on my Instagram, and definitely on my Instagram. I don't know about Facebook, but definitely will be sharing epilepsy facts on my Instagram the whole month of November. So if you want to be informed, check that out. And yeah, I will see you guys next time. Thank you so much for joining me. Bye.